Okay, we're going to look at the hip extensor muscles. So just to orient, we're in the sagittal view and the sagittal plane for hip extension, and the axis is the medial lateral axis. And so the motion goes posterior about that hip joint. So let's start this, and we can see the hip going into open chain extension. And here's a posterior view, and we can see the major muscle is the gluteus maximus. And then we also have our hamstring muscle group that passes the hip joint posteriorly on the posterior side, as well as the knee joint. And so all of those muscles help with hip extension. So I'm going to just roll through here and stop it here. Here on the lateral side is the biceps femoris long head. We'll talk about the short head when we get to the knee. Then we have on the medial side, you have the semitendinosus. And I always remember they're on the medial side because they're medial. Semitendinosus is superficial. And then the deep medial hamstring muscle group is a semimembranosus. So a lot of M's in semimembranosus. So that's the deep on the medial side. Moving on to see the specific muscles. So the posterior hip muscles generate this internal extensor torque because the line of pull is posterior. Most of them also create or generate an external rotation torque or a lateral rotation torque. And we'll talk about that in those muscles in a different video. But for the main extensor torque muscles, gluteus maximus, right? Medius and minimus, you always put together, and they're abductors. And then we have the hamstring muscle group, which is a two joint muscle group, and it crosses both the knee, and it's posterior to the knee, so it's a knee flexor, and it's posterior to the hip, so it's a hip extensor. So we have the biceps femoris long head on the lateral side, and then you put together the semitendinosus and the semimembranosus on the medial side. So the gluteus maximus, as I mentioned in a previous video, goes on the iliac crest to the sacrum to the coccyx and inserts into the gluteal crest. And it also goes into the IT band. And remember, as opposed to the gluteus minimus and medius with the innervation of superior gluteal nerve, the gluteus maximus has the inferior gluteal nerve. So when you're comprehending your anatomy, it's good to like chunk things by movement, by what goes together, and then these like weird thought discrepancies that maximus is the inferior gluteal nerve. Now looking at the hamstring muscle group, which again, will cover the biceps femoris short head in the knee videos. All the hamstring muscle groups come off the ischial tuberosity, and the biceps femoris goes to the lateral head of the tibia and the head of the fibula. So think lateral side, fibula. These all the hamstring muscle groups share the two joint ones, share the neural innervation of sciatic nerve and the tibial portion of the sciatic nerve. Then on the medial side, we have the semitendinosus, which is superficial, again, coming off the ischial tuberosity to the medial condyle of the tibia. And the semimembranosus, which is also medial, deep to the semitendinosus, which is coming off the ischial tuberosity to the medial condyle of the tibia. And those semimembranosus, semitendinosus, biceps femoris are all sciatic nerve innervation.